The recent changes in the workers' comp system have turned it into an HMO. And you basically have 8 sessions and you can get renewals. You're very lucky, actually, if you get more than a couple of renewals. And so the question is, what kind of obligation do we have to fragile clients who continue to need services, but whose funding has been denied? And this is a problematic managed care issue across the board. There are kind of two levels of things. One is it's both a matter of conscience and ethics. My sense is that we have an obligation to try to find appropriate services if the person needs them and we can't provide them. But we are not obligated, either legally or ethically, to do therapy in perpetuity for free. And so this line between how far do we go and in terms of providing free services, if that's what we're required, or that's what the only option is, and whether we can terminate with a client is a very difficult one to draw. I think we end up making for ourselves an ethical decision and a kind of a moral decision of, do I just need to hang in with this person knowing that I will not be compensated, and how long am I willing to do that? Legally, we're not required to provide services for nothing. That's called slavery. And we can terminate with a person if we are no longer being paid. From an ethical perspective, though, it's important for us to be able to try to find appropriate services. It's amazing to me, we talk about referring to free services, and free services are getting less and less and less available. But I would encourage you to think about, in terms of potential referrals, if workers' comp is simply not an option any longer. There are a number of agencies that provide lower fee services and do so through interns. And that may be one way to provide the necessary referral to an agency as opposed to an individual. However, I know that there's a limit to that, and sometimes those referrals don't take. From a strict legal perspective, we are not required to continue to see somebody when they don't pay. How do we terminate? We need to take our time. We need to try to, as best we can, refer them to appropriate providers. If there aren't any, there really aren't very many solutions. In those rare but very troubling cases where there's nobody available to take a client, we are stuck with what I think is essentially a moral choice. It's no longer governed strictly by what the law says about I'm simply free. I may not feel free to discontinue with a particular client. One thing to keep in mind about both terminating because of lack of resources and also the HMO model, if you have sought extensions and they've denied you, you should definitely follow through and appeal the denial. So you should take the...
I've done that.
Good.
And they have granted 2 or 3 times.
If you have an insurance company that is you've contracted to provide services to someone at a reduced rate, and they have a limit on sessions, for example, 20 sessions, is it required that you continue to see this client at that reduced rate after the 20 sessions is up and the client still wants to see you, or can you charge them your usual and customary fee? One of the critical components here is that you must inform people ahead of time. So if you say you have 20 sessions, up to 20 sessions at $88, if you were to choose to continue after that, my regular fee, for example, is $125, then that would be considered appropriate. But if we spring it on a person at the end, then it becomes problematic. Well, then, for example, Blue Cross couldn't say, we contracted for you for $88 and now you're charging $125. And here again, this is about being clear and informing folks up front. We inform our clients, but we also inform the insurance company. And we find out, are they saying that if we're going to work with this client even after the 20 sessions, that we have to be paid the same amount? If they say yes, then you've got to decide whether you want to work with Blue Cross Blue Shield. If they say it's up to you, then you act accordingly. I think it's a matter of contracting with folks and saying, being clear upfront in an informed consent process, and also being as clear as possible, preferably in writing with the insurance company, but being as clear as possible about that practice at the outset as well. To me, it seems to be mostly an informed consent issue, and the right to change a contract so long as we're being sensitive to the fact that we have an ongoing relationship with a client. Questions about billing and no-shows in private insurance and workers' comp, where people give you no notice and they don't show. Okay, and with respect to insurance billing and also workers' comp, neither of those will pay for no-shows, even when we have policies that say that patients are obligated to pay for those sessions. It's relatively uncommon, if not unheard of, to have private insurance pay for no-shows, and workers' comp definitely will not pay for no-shows. So we are not allowed to bill insurance for those. The question that emerges is, can we bill the client for it? And it's going to depend on the nature of the contract you have with a specific insurance company. This means actually culling through or having an attorney read through the contract and determine whether that would be prohibited. If it's not prohibited, you could bill the client so long as the client has previous warning at the beginning of services that they will be individually responsible for paying for sessions that they don't call you about in sufficient time, because you will not be able to bill insurance or workers' comp. With respect to workers' comp, I would be very cautious about engaging in that activity with clients, partly because there are some pretty strong restrictions on how we bill, and I'd want to get in writing from the government, not likely, but in writing from the government, the statement saying that you're able to do that without it contradicting the law. Some doctors' offices developed a policy about using a mediator where there's a disagreement between the provider and patient. Would that apply to psychotherapy? Can we develop something similar to it to protect us from lawsuits? Yes and no. This idea of using an arbitration service is actually fairly common. I don't know if anybody here works for Kaiser, but Kaiser, for all of its members, basically requires that one uses arbitration and says that if you're going to be a member, you can't sue us. And you must use an arbitration panel. And individual doctors also can say, I would like to have my clients or my patients only use an arbitration process first. It's possible to contract with people, but if people object to it, that if our potential clients object to it, then the option is either they don't see us, or they do see us and we take the risk that they can sue us. I actually don't know that this is the most, I mean, it's a nice idea and it moves us out of a traditional lawsuit environment. On the other hand, given the number of lawsuits for non-medical mental health providers, I'm not sure that it's all that important to do. Of course, that's assuming that you're the person who doesn't have a lawsuit against you as opposed to one who does. As a reminder, the research suggests that about 1 in 19 mental health professionals who are non-physician providers can expect to be sued during the course of all 19 careers. So it's a fairly rare event. Now, if it does happen, the major issue is, have we met the standard of care? The reason I say yes and no about can we do this for psychotherapy is I have not yet seen whether case law has tested the viability or the legality of an arbitration agreement in a psychotherapy practice. And one of the ethical sides of the argument that I've heard is that because the psychotherapy relationship is so different than than a physician-patient relationship, a lawyer-client relationship, and so on, that an arbitration agreement might be considered overreaching or abusing the power that the psychotherapist has. And so that hasn't been resolved. I generally don't want people who I teach or who I consult with to be test cases. But if you're interested in taking a bit of a risk, you know, I would get consultation from a knowledgeable attorney about arbitration agreements, also a knowledgeable attorney regarding mental health law to see if there's been any emerging standards around this, and then have that person craft it for you.